Our study was about early diagnosis of Alzheimer's disease because it's very important to diagnose the patients early. After neurodegeneration has taken place, we cannot reverse the pathological process in the brain. So we know that from the studies, we know that the pathological changes start 20 years before the patient becomes cognitively deficient. So when a patient comes to you saying that I don't remember things, I forget things, probably it's been like 15 years that the pathological processes had been going on in the brain. So we are interested in an easy method to diagnose Alzheimer's disease early. Our method is basically an MRI method. It's a functional MRI method. So we added it to the structural MRI. It just adds 5 minutes, and it doesn't use a tracer radioactive material like PET scan, but it's very consistent. The results are very consistent with the PET scan results. So we can use it. It is safe. It just takes 5 minutes, and it's cheap. So we did basically this study in 85 patients in 6 months who came to our clinic. Most of the patients had Alzheimer's disease and MCI, minimal cognitive impairment. The others were depressed. We saw that a hyperperfusion pattern in parietal lobes, bilateral parietal lobes, were detected in the Alzheimer's patients and the MCI patients. Hyperperfusion patterns were more frequent in the Alzheimer's patients. It was 83% of the Alzheimer's patients, and 63% of the MCI patients had the hyperperfusion pattern. We know that not all of the MCI patients turn into Alzheimer's disease, so we think that if we can track these patients in the long term, we will see that some of them who had the hyperperfusion pattern will turn into AD. So this is the idea of the study. There are methods that we can detect the people who have risks, but they are very expensive, like amyloid PET scans. But this is a very good study because it is very easy to access. Just an MRI machine, you just need an MRI machine. So there are many studies with ASL MRI. Some people use quantitative measures, but this is research-based. So we think that clinically we may use it. Of course, besides neuropsychiatric evaluation, not just imaging. We do the mental examination, neuropsychiatric evaluation, and the blood test and the structural MRI, and this will help us.